Community spread means COVID testing sites are packed. A shortage of some of the test supplies means results are very delayed, up to 14 days in some cases.
There is a lack of some reagents that are out there, so we're dealing with that.
Because of that, Lucas County Health Commissioner Dr. Eric Skudzinski says you need to know what to do immediately after any COVID exposure. If you have been exposed to a person who is confirmed to test positive for COVID, you need to self-quarantine for 14 days.
Because the disease runs its course between, let's say, 2 to 14 days. So that's why we say you should be quarantined for 14 days.
If you develop COVID symptoms and test positive for the virus, you need to isolate for 10 days.
Isolation is staying away from other people who might be at risk, who you might expose. And we know through the data and through best practice and through following CDC guidance that time period should be 10 days.
This also means you're fever-free for 24 hours without medication and improvement of your respiratory symptoms. Now, because of the delay in testing, healthcare systems are treating patients based on their exposure dates to COVID and any COVID symptoms.
The no-test strategy relies on people isolating based on the presence of symptoms and then quarantining based on the presence of an exposure.